Hi, I am Professor Timur Gurgan from Istanbul, Turkey. I am with you now to give you some information to share with yourself as a couple if you have the problem of achieving the baby, or you may have someone to share this information to help them to have their child or children. I want to start with the description of the infertility. Infertility is a state of the couples, even if they want to have their own children, they cannot have it for a period of time. The question is, when they want their children or child, or how long they are going to start to get some support from the professionals. Think about that. If you are just found your loved ones and you want a baby, so you could try to have your children for a period of time. In the literature, if your information is enough, so you could get your pregnancy up to 75% in 1 year time. If you wait additionally, one additional year, it may increase to 93%. So if everything is okay, if you have the time, you could have it yourself. As a professionals, we are happy to let you know or let you do whatever you want to come us with the positive pregnancy test. It's okay. But there are lots of status or some kind of problems which may be coming from the male side or the female side, which can postpone the pregnancy or to make the pregnancy sometimes impossible. So the professionals have to have a task to search for the reasons or the kind of problems which may cause you not to have the pregnancy when you want. The problems can come from the male side. The problems can come from the female side, or the problems may have happened from both sides. So what are we going to do? When are we going to start? Do we need a help as soon as possible, or we have to go to some kind of centers, and we think that, and it could make it, a kind of possible with the help of some technology as soon as possible, which these centers can name as IVF centers or test-to-baby centers. As a very experienced person who have been working in this area in reproductive medicine, reproductive endocrinology, reproductive surgery, and also assisted reproductive technologies for years, I can tell you that. Don't go to any kind of centers with your own diagnosis. And don't go to any centers asking, first of all, to have the IVF. Because you should know that any kind of reasons which may cause you to postpone or not to achieve the pregnancy as soon as possible can affect any kind of treatment results. You may need to find out, or the professionals need to find out exact cause or causes which may cause the infertility. So you can think that if your partner or the male, there would be no sperms to fertilize the oocytes, or the female cannot have the egg to be fertilized, or the problem can come from the production of the egg, production of sperm, production of any kind of negative hormonal, immunological, genetics, or infectious problems you have had before. So the important thing is we should understand what's going on. And I can tell you easily, and just now I can tell you that you don't have to go to IVF as soon as possible. So we have to find out the causes. And you may have a problem, the hormonal problems. It could be corrected easily by using any kind of drugs, and you can get pregnancy. You could have a small problem with the fallopian tubes, and we could make a kind of, the diagnostic technology use, or you could have a small operations using a kind of laparoscopy to get rid of it. You could get the pregnancy, or even if you could make your psyche better, and you could get pregnancy. And all that you could hear from your friends, from some resources, even if some people or some couples cannot achieve the pregnancy with IVF, with the high technologies. After the failure of this technology, you could hear that they could get spontaneous pregnancy. What's going on? So we will have the task and the responsibility as the professionals first to find out the reasons, possible reasons. I can tell you now, everything happening has the reasons. Without reasons, nobody can give the diagnosis of unexplained pregnancy, which you may hate. So this is the first, let's say the video that I can tell you that, please, be patient, be relaxed, ready to take the information which you could understand what's going on. Sometimes, even if the best professionals cannot tell you the exact diagnosis, but with their experience, with their information, education, and with their, a kind of experience, they could understand which is the problem cause your infertility. I will tell you in the next videos what should be done by you, what will be done by us. At the end, we have to have a kind of a contract to start with, theoretically, to help you to achieve a healthy pregnancy, which may be ended with the healthy pregnancy.